Welcome. I'm Dr. Stephen Cabral, board certified Doctor of Naturopathy and founder of the Integrative Health Practitioner Institute. I appreciate your time here right now learning a little bit more about our IHP community and our health coach certification. What I wanted to share with you is that over the past 25 years, I've been in the health and fitness and wellness-based industry, starting as a personal trainer and certified nutritionist, working up to a certified strength and conditioning professional, working with athletes, celebrities, and of course, everyday people. Went back to school, got my doctorate degree, and understood that I really wanted to help people, but I didn't know how best to help them from a natural health perspective. I knew that I wanted to teach them about exercise and nutrition and proper science-backed supplementation and overall lifestyle and detoxification and healthy biohacking, but there was nothing out there that was able to put it all together for me. So I ended up doing internships in India and Sri Lanka and China, Europe, and all over the United States. And with that information, I began to understand that there is no one best form of health. There isn't. And that's why some people get better with Ayurvedic medicine or traditional herbalism, or they get better using a specific nutrition plan. But really what I understood is that you can help everyone every time they come to you if you don't make them fit into a particular modality. So I made it my mission to create a truly integrative approach. And I opened up one of Boston's first functional medicine integrative health-based practices. We were using infrared sauna, red light, Ayurvedic-based massage, of course, precision-based nutrition, and so much more before it even became popular. We ended up having a 6-month wait list. We saw 20,000 appointments per year and over 250,000 one-on-one appointments. And all of that information enabled me to then start to move to more of a global level. We moved our practice online. We started seeing people now in over 27 countries from around the world. But what was really fascinating is that I got to speak with a lot of practitioners. Probably practitioners made up about 25% of our private practice. And they always asked, how do we learn to do what you're doing right now? How do we use at-home lab testing to figure out what we need for our body, our deficiencies, or how to remove our toxicities? And when I started the Cabral Concept podcast, I kept getting those same questions. And so after a few years, I said, you know what? We're going to create an institution, a teaching and research-based institution that can help people no matter where they're at right now to learn how to heal themselves and then go on, if they choose to heal others, to become the health coach in their home, to get the education that they didn't learn in school but they deserve to be able to not just use the information for them to heal, but teach it to their children or their parents or their grandparents or their coworkers, their friends, their family. So inside of IHP right now, you'll find that, sure, half of the people come from a fitness-based background like I did with personal training or nutrition, or maybe it's massage, or they're an esthetician or acupuncturist or chiropractor or doctor or nurse practitioner. But half of the people have no prior health-based work experience or really knowledge. And we love that, how those communities come together, because everyone has a unique background. Everyone's here to learn. Everyone's here to serve, myself included. So one of the interesting things and new things about IHP is that it is a practitioner taught and led program. That means you're not getting 50 different voices. What you're getting is a tried and true functional medicine, integrative health-based approach that combines 7 disciplines of IHP, and I invite you to look more into that. Ayurvedic medicine, traditional Chinese medicine, herbalism, bioregulatory medicine, Eastern-based philosophy, because we do a lot with the mindset to overcome dis-ease of the body, and many more, at-home lab testing. But one of the really unique things is that we want to empower you to take back control of your health and help others do the same. And so what we've taught is the whole de-stress protocol from my book, The Rain Barrel Effect, in depth, precision-based true health, right? It's the way to help people to rebalance the underlying imbalances that keep us sick in the first place. You know, a disease is simply a name given to a collection of symptoms. Well, you most likely didn't have the symptoms when you were 5 years old or 10 years old. So why did you get them at 17 years old like me, right? I had a 10-year health battle. And the only reason I had to deal with that for 10 years is lack of information. Unfortunately, the practitioners I saw didn't have the answers that I was looking for. Now, they were good people, they meant well, they had pieces of the puzzle, but they didn't integrate it. They didn't put it together. And so I've spent my life trying to accumulate the knowledge and now the data with one of the largest research projects in the world with over 250,000 client appointments And I can use that and now I can teach it to you. Because I'm only one person, and although I work hard, I learn, I research every day, and I want to teach to you, at most, I can work with about 2,000 people a year. My team, about 20,000. But as an IHP community, we can serve tens of millions of people and make an enormous dent in this world for good. So if you're looking to learn more about IHP, I invite you simply to download our brochure, watch one of our webinars, get on a call with our admissions team. We only allow in 100 new students per month. We are not looking to invite in 1,000 people per month. We keep the community tight-knit. We do live workshops every month. You get lifetime access to the curriculum. We're here to make sure that, honestly, you succeed. You succeed in your own health goals, but also I do hope that you'll teach this information to others. So we have a bonus-based module on how to create a practice that you can love, that you absolutely are proud of what you're doing. And you can do all of that, believe it or not, just like I'm talking to you right now in video. We teach you how to develop a virtual practice with no overhead costs. Very simple, very straightforward, working with one person a day or maybe 4 or 5 people per day. That's your option. But the first step is getting started. So empower yourself with the gift of health, the gift of knowledge, and we'll be with you literally every step of the way. Next step is simply to get a little bit more information. Download the brochure, set up a no obligations call with our admissions-based team, and I'm always here to help as well. Take care, and I look forward to seeing you in the IHP community soon.